All right, well, just last month, the American Psychological Association warned it was deeply concerned about the potential overturning Roe v. Wade had to harm women's mental health.
Now that moment is here, and well, many women are feeling a range of emotions. Why don't we speak now, get some reaction to where we are right now with Dr. Sue Varma, a board-certified psychiatrist. And I'll just start by saying that really there are so many intense emotions around this issue. I mentioned that some people have been celebrating today, but people have also been crying today. There's been anger. In some cases, some of these emotions can be overwhelming. I'm curious, what do you say to somebody that maybe is feeling a bit overwhelmed with what they're feeling?
Absolutely. You know, we really need to come together and create safe spaces for one another with like-minded people who are able to share openly what we're going through. I think it's really important that we also be able to process our emotions, again, safely, because you might be talking to somebody who has no empathy and, in fact, to your situation, and, in fact, might be feeling quite the opposite. We also need to prepare. I always tell my patients that from an emotional perspective, we need to process what we're feeling, including grief, including anger, noticing how it's taking form in our mind, in our body. A lot of people are telling me today, my patients, that my heart is racing, I'm having headaches, I think they're going to have trouble sleeping, I feel nauseous. A lot of time our symptoms of anxiety start to manifest physically before we're even aware of it on a conscious level. The second thing, in addition to processing your emotions, is I talk about problem solving, is what are you going to do? Does this impact you? Does it impact somebody you love? How can you prepare for this? What does this mean for your healthcare or for your loved ones? Which kind of a state are you in? What kind of services do you have access to? Do you need to talk to your doctor? Do you need to provide help? Do you want to help people? So there's a lot of things we can do, but in the moment, it's very hard to feel that we have a sense of agency.
Let me ask you this. For women who are living in the States who may no longer have access to abortion very quickly, talk to us about the mental health ramifications of those women specifically.
We are talking about a huge mental health fallout that is about to come. We are already in the midst of a mental health crisis with suicide rates going up astronomically, especially in the young adult population. So if we're talking about women who are, let's say, marginalized, who already live in rural areas, who might have poverty, who might have medical problems, who might already be single moms, or in general, we're just talking about women's mental health, anxiety going up, depression going up, self-esteem going down, the doctor-patient relationship and the confidentiality and the quality of that relationship is really going to be deteriorated, as well as a woman's self-esteem. So a lot is at stake here, medically, physically, mentally, all of it.
I want to ask you about sort of relationships, right? Because not everyone feels the same way about all things. And this is one of those issues where you have people, good people who have polar different opinions, right? How do you have those conversations and relationships with people that may not feel the same way that you feel?
So ask yourself when you're having these conversations is, what is my intent? What am I hoping to gain from this conversation? What am I potentially going to lose? What is the context? Are we with a large group of people in a happy, upbeat family celebration? Do I really need to have this conversation right now? And is something going to change as a result of it? So if something will change as a result of it, then sure, have that conversation in a private space when maybe you're not drinking alcohol, when you're able to have a rational conversation, and when things get heated, to be able to say, hey, you know what, let's take a break. You know, let's change the subject. But I'm a big believer in trying to maintain relationships as much as possible, because in addition to a mental health crisis, we're also dealing with a loneliness crisis. Loneliness can come from a paucity of relationships, not having too many close people, or it could be the quality of the relationship. If it's your partner, and if these reproductive changes are going to affect your rights and your partnership, and there's something immediate to be had, then of course you must have the conversation. Otherwise, if you're talking to your 95-year-old grandmother who, you know, has very strong opinions opposing yours, ask yourself, what's the purpose of this conversation? Am I really getting anywhere? Am I really changing their mind? And if not, maybe you don't have it. So I'm more of the belief of pick and choose your battles, and decide how you want to share your energy and protect your energy, and do it wisely.
All right, Dr. Varma, thank you so much for joining us this afternoon to navigate this.
Absolutely. Thank you for having me.
Appreciate it.
Protect